Hello, my name is Kevin Gibbons. I'm the Executive Director of UBMD Physicians Group and the Senior Associate Dean for Clinical Affairs at the Jacobs School of Medicine and Biomedical Sciences here in Buffalo, New York. Over the course of the last 6 months, I've given a number of presentations on the status of COVID-19 in our community and in our country. I invite you to look at those at ubmd.com, and they're also available on YouTube. We're now towards the end of the first week of May. There are some things that are changing in our community and our country and our world, and I'd like to review some of that with you now. I'm going to screen share with you now. So this is the May update. I'm going to go over disease trends, national, state, Western New York, and importantly, worldwide. We'll talk a little bit about gatherings, things we should be able to do now that we are hopefully vaccinated. I'll talk a little bit about vaccine rollout and hesitancy. I went over that to a greater degree in some of the previous talks. I invite you to check that out. I'd like to talk and spend some time talking about clotting risks, both the risk with COVID-19 illness and with the vaccines, because that's certainly been in the news. And we'll spend a little bit of time talking about where we go from here. So in the US, we clearly had that major spike, exponential rise, followed by an exponential fall centered around the first week of January. We're now at a situation where things have sort of plateaued, and plateaued still at a pretty high level. You can see hospitalizations remain plateaued, deaths remain plateaued. That death number is sort of stuck at 700 to 900 people a day losing their lives to COVID-19 in this country. Keep that number in mind when we start talking about vaccine risks, which I'm going to go over in some detail towards the end of this. Here in Erie County, we sort of had a double spike around the new year. We started in November, and then things finally came down in February. And we've had this unexplained April spike that now also is going down. But again, there are some signs that this is starting to plateau at an unacceptable level, much higher than we were last summer. Some information, this slide sort of tells you what's been going on from February to now. The hospitalization rate for people ages 20 to 64 is steadily going up, and the hospitalization rate for 65 and over is steadily going down, probably reflecting the aggressive vaccination policy and practice of our senior citizens. Worldwide, again, a spike in the winter came down, but now in the last month or so, clearly going up. This reflects conditions in Brazil and Argentina, and most importantly, in India. This is a worldwide epidemic, a pandemic. It is really affecting every country in the world. Of note, in sub-Saharan Africa, it doesn't look like they have a lot of COVID, but there are some suggestions that that's not true. In an autopsy study in a major area that did not have any recognized COVID-19, they found that 25% of people who died indeed did have COVID-19. So I think we are seeing this truly worldwide. But of course, in the news is India. Right now, the United States is at the top of the list for total number of cases and total number of deaths. But by the time you hear this, in all likelihood, India will have taken over that dubious honor. And it's been a terrible situation. You can see the spike in cases on this graph over the last couple of weeks. The healthcare system in India is overrun. They have run out of oxygen in many hospitals. People are dying from COVID-19, and people are dying from treatable conditions because the healthcare system is overrun. So this is absolutely horrific on a human scale. So we should be concerned about it for that. But we should also be concerned because the more infections there are, the more mutations, and the more variants there are. We already have 3 new variants coming out of India in the last 7 to 10 days. And so we have to follow the situation there very carefully because this virus does get its way around the world quickly. So why are variants of concern? Well, the natural thing is to think, well, if it's a more deadly virus, we have to be really worried about it. Something Ebola, which kills 85 to 100% of its victims. But more contagious viruses actually kill far more people. SARS and MERS, previous coronavirus infections, killed 10 and 23% of the people who got the disease. But they have killed far less people than COVID-19, an illness which has a case fatality rate of less than 1%, but because it is so wildly contagious, it has killed far more people than those other conditions. That's shown pretty well in this graph here. The other thing about variants of concerns if they vary enough, if they are different enough, they can escape our existing immune protection. We've talked about cross-variant immune protection. That's the fact that if you get infected and recover from one variant of this virus, you should be immune to the next variant, unless the variant is so dramatically different that it escapes our existing immune protection. And our vaccine-induced immunity, which is incredibly strong so far, there could eventually be a variant that escapes that. Right now, the evidence is that our existing vaccines work very well against the most dangerous variants we've seen. The UK variant, which is more lethal and more contagious, and the 3 new variants out of India do appear to respond very well to our existing vaccines. So one of the questions is, now that we've been vaccinated, what can we do? It seems like it's slowly seeing a release of some of the fairly strict measures that have been in place now for over a year. What can fully vaccinated patients do? Well, remember, these vaccines are incredibly effective. The mRNA vaccines, 95% plus for illness, and essentially 99 to 100% plus for death and serious illness. So if I have no hesitancy in having 3 or 4 other couples come join my wife and I for dinner, sitting around the dinner table without masks, knowing and confident that everyone's been vaccinated. The chance that one of them is not immune protected because they were in that small group where their immunity did not kick in. The fact that you might have 2 people at the same table in a group of 10, when you start doing the math on that, the chance of that happening is really less than 1%. So that effectiveness of the vaccines gives us confidence. Now, I don't know that I would invite my 10 closest friends to each invite 10 of their closest friends and have a party with 100 people in a close, enclosed environment with poor ventilation. I don't know that we're there yet. Hopefully we will be soon. It's important to note that the CDC is a little bit slow in relaxing some of the restrictions that they've put forward. They are catching up to the science, and I think they will catch up to the science. There's a lot of things people who have been vaccinated can do safely. Now, I'd like to mention something about the role of masks. I go to New York City a lot. When I was in New York City in November and December, 100% of people masked 100% of the time outdoors, even though the science said it wasn't necessary. Well, New York had been through hell, and I wasn't going to criticize people for taking that extra measure of protection to get comfort. Now we know outside is very safe. Vaccinated people are safe. Now, when you go to New York, you see more and more people outside without masks, and that's fine. But I still wouldn't criticize someone who still needs that extra measure of comfort in the sense of self-protection. Vaccines, I've talked about the effectiveness. They're highly effective vaccines. The rollout has gone reasonably well. We now have more vaccines than people willing to take it. 50% of Americans have received at least one vaccine, 30% are fully vaccinated. We need to push those numbers into the 75, 80, 90% if we're going to put this COVID-19 pandemic behind us. Otherwise, we're going to be stuck at a level of low constant infection that we're going to have outbreaks and we're going to be dealing with this forever. It's important to note that it's likely that the mRNA vaccines will be approved for use in ages 12 and up. That's a very important step, remembering 25% of our country is age 18 or younger. So now I'd like to talk a little bit about the safety of these vaccines. But before I do that, I'd like to mention effectiveness. We've heard about, quote, breakthrough cases. These are people who have been vaccinated who do indeed subsequently come down with COVID-19. Well, Michigan provided a really good case study on this 4 to 6 weeks ago. We looked at these numbers carefully. The population of Michigan is 10 million. It's a nice round number. At that point, 2 million had been vaccinated, 8 million had not. Among vaccinated individuals, there were 3 deaths. Among unvaccinated, there were 17,000. So clearly proof of the effectiveness of this vaccine. So how to become immune? Is it better to be vaccinated or get infected and recover? Well, when you get vaccinated, you control when, minimal risk of death, probably 1 in a million, maybe 1 in 2 million. The strength of the immune response is much greater. With natural disease, it's random or uncertain. There is the risk of death. 1% of men aged 60 to 69 with symptomatic COVID die. The disease can take its toll. The long haul syndromes are real. I appreciate the smell and taste of food and coffee. I don't want to lose that. The strength and duration of immunity through natural infection is unknown. In both situations, in all likelihood, if our immune system fails at some point or the virus changes enough, we will need a booster shot. I'd like to talk a little bit about blood clots, which the technical term, the medical term is hemostasis. It's an amazing thing. It's why when we cut ourselves, we don't bleed to death, but at the same time, our blood does not clot uncontrollably and cause heart attacks and strokes. This graph gives you some idea as to the complexity of the clotting system. We use this graph to torture medical students. We make drugs that intentionally affect part of the clotting system, and we use drugs for a lot of reasons that unintentionally affect part of the clotting system. So the risk of clotting with COVID-19 illness is high. 25% of patients admitted to the hospital with COVID-19 illness have abnormalities in their clotting disorder. On the arterial side, it can cause heart attacks and strokes. We heard early on in this pandemic about that young actor in LA who had his leg amputated. He subsequently died from COVID-19. It can be venous clots, typically clots going into the lung, pulmonary emboli. And there's also something called cerebral venous sinus thrombosis, or CVST. This is a specific type of blood clot in the large veins that drain the brain. And it is associated with these vaccines, but we also see it regularly. We typically take care of at least 5 per million a year at the Gates Vascular Institute. We see it in a high number of patients with COVID-19. We see it with pregnancies. We see it in individuals who use birth control. So we've seen this problem before, but we particularly see it with the adenoviral vector vaccines. So the J&J vaccine was out in this country, 8 million doses were given, and all of a sudden there were case reports, 6 cases of cerebral venous sinus thrombosis with 1 death. So they stopped the vaccine for now because they realized they'd already given it to 8 million. Many of those people were still within the first 2 or 3 weeks of vaccination. That's when this occurs. It does not occur down the road. So after a pause, they waited, and a total of 3 deaths. So 3 out of 8 million. Okay, that's 1 in 2 million plus patients. It's a low number. Interestingly, all in women. Over in England, 20 million doses, 80 cases, 19 deaths. So 1 in a million. Again, mostly women. So remember I talked about 700 to 900 Americans dying every day from COVID. Imagine a situation where if you could wave your magic wand and vaccinate everyone in this country one time with a one-time risk of death that would affect between, if it's 1 in 2 million, it'd affect 170 people. If it's 1 in a million, it'd be 330. But that would be the death toll from vaccination, less than 400 people. And we would eliminate essentially COVID, okay? As opposed to continuing to have 700 to 900 deaths a day. So the question is, the child, the backseat, are we there yet? Well, the answer is yes, if you're talking about protecting the most vulnerable. We are doing a great job with our seniors. They have willingly gotten vaccinated and their death rate has plummeted. We are there that we have safe, effective, and widely available vaccines. Right now, we're there protecting the healthcare system, although I'll tell you that in Western New York, 2 weeks ago, we were getting close to the edge of having to cancel surgeries and take extraordinary precautions because the hospitals were full with that bump in COVID patients. We're not quite there yet in terms of population immunity or herd immunity. We may never get there if only 50 or 60% of our country is vaccinated. The concern about the variants is real. We have to track these very carefully. We have to hope for the end of the pandemic. If not, we're going to be at what we call an endemic level. There's going to be a constant low level of COVID. We're going to have outbreaks every so often. We're going to have an occasional super spreader event where people who are not vaccinated happen to cluster when someone was sick. It's going to be a problem. We really can put this behind us, and we should try. It's important to note that this is not our first coronavirus epidemic. It's actually our third in the last 18 years, and it will not be our last coronavirus epidemic. We need to start planning for the next one. So please stay safe, get vaccinated, and encourage your friends and families to get vaccinated. We need to invest in public health. We need to do things better the next time. We need to teach our youth to learn about science, tell them that's how their iPhones work. And we need them to become the leaders in science and medicine in the future as we go forward. Thank you very much.